Hello, everyone. I'm Myada, and today we're diving into one of the core concepts in epidemiology, identifying risk factors in health research. Whether you're a medical student, researcher, or just curious about public health, understanding how we pinpoint risk factors is key to unraveling the mysteries of disease. So, what exactly is a risk factor? Simply put, a risk factor is anything that increases the likelihood of a person developing a disease or injury. These can be lifestyle factors like smoking, biological factors like genetics, or environmental exposures. Risk factors come in many forms, and we typically categorize them into three main types: behavioral, environmental, and genetic. Let's break these down. Behavioral risk factors include actions or habits that increase disease risk. For example, tobacco use and poor diet are major behavioral risk factors for conditions like heart disease and cancer. Environmental risk factors are exposures that increase disease risk, such as pollution, radiation, or even unsafe drinking water. Think of how living near an industrial area might expose someone to harmful chemicals. Genetic risk factors relate to an individual's inherited traits. For instance, a family history of breast cancer can be a genetic risk factor, which may increase a person's likelihood of developing the disease. Now, how do researchers actually identify risk factors? It starts with observational studies. These studies examine populations over time to see which factors are associated with increased risk of disease. There are different types of observational studies used in epidemiology: cohort studies, case control studies, and cross-sectional studies. Once risk factors are identified, researchers measure their impact using statistical tools. You'll often hear terms like relative risk and odds ratio. These measures help us understand the strength of the association between a risk factor and a disease. Relative risk tells us how much more likely an exposed group is to develop a disease compared to a non-exposed group. For example, smokers may be 15 times more likely to develop lung cancer than non-smokers. Meanwhile, odds ratio is often used in case control studies to express the odds of exposure among cases versus controls. Why does identifying risk factors matter? Well, it helps us prevent diseases. By recognizing what puts people at risk, we can design interventions like public health campaigns, screenings, and policy changes to reduce those risks and improve population health. To wrap it up, identifying risk factors is a fundamental part of epidemiology. It helps us understand the causes of diseases and paves the way for prevention and treatment. Whether you're a researcher or just interested in health, knowing how risk factors are determined can deepen your understanding of how we keep populations healthy. Thanks for watching.